Gaza hospital crisis, a struggle for survival amid war. The healthcare system in Gaza is on the brink of collapse as hospitals face an unprecedented crisis due to ongoing conflict. Dr. Nizam Mahmoud, a retired transplant surgeon who spent a month at Nasser Hospital in Khan Yunis, Gaza, described the conditions as catastrophic, with overcrowded wards, a lack of essential medical supplies, and the deliberate targeting of medical facilities and personnel. This alarming situation raises urgent questions. Why are Gaza's hospitals in crisis, and what is fueling this humanitarian disaster? Overwhelmed hospitals and collapsing infrastructure. Gaza's hospitals, once functioning under already fragile conditions, are now struggling to cope with a massive influx of war-related casualties. The destruction of key medical facilities and severe restrictions on medical aid have left hospitals unable to meet the needs of thousands of injured civilians. At Nasser Hospital alone, over 800 patients are crammed into spaces meant for a fraction of that number. Operating rooms function without anesthesia, doctors perform life-saving procedures by flashlight, and the absence of basic antibiotics puts wounded patients at risk of deadly infections. Dr. Mahmoud's first-hand account paints a grim picture. Patients lying on blood-stained floors, exhausted doctors working 20-hour shifts, and emergency rooms so crowded that the wounded must be treated in hallways. In one instance, he described a 12-year-old boy who had lost his leg in an airstrike, but there was no pain medication available for him. "We are forced to choose who gets treatment based on their likelihood of survival," he said, acknowledging the heartbreaking reality of war medicine. Medical supplies such as surgical kits, blood bags, and pain relievers are running out, and over 70% of Gaza's hospitals are now non-functional due to bombings and electricity shortages. Without urgent international intervention, the situation will only worsen, leaving thousands without life-saving medical care. Deliberate targeting of hospitals and medical personnel. One of the most shocking aspects of the crisis is the reported deliberate targeting of hospitals, ambulances, and medical workers. According to international organizations, multiple airstrikes have hit medical facilities, further crippling Gaza's ability to provide health care. The destruction of Al-Shifa Hospital, Gaza's largest medical center, is a stark example of how conflict zones become death traps for the injured. Doctors and nurses are risking their lives to continue working under these extreme conditions. The World Health Organization, WHO, reported that more than 300 medical personnel have been killed or injured since the start of the conflict, making it one of the deadliest wars for healthcare workers in modern history. Ambulances have also been targeted, preventing critically injured patients from reaching hospitals. One heartbreaking example is Dr. Ahmed Al-Khalut, a surgeon who died alongside his entire medical team when an airstrike hit their hospital during surgery. The loss of trained professionals further worsens the crisis, as fewer skilled doctors remain to handle the overwhelming number of patients. The question remains, why are hospitals being targeted? Some analysts suggest it is part of a broader strategy to weaken civilian resistance by cutting off access to medical care. Others argue that in a densely populated war zone, civilian infrastructure, including hospitals, becomes collateral damage. Regardless of the intent, the reality is clear. Gaza's healthcare system is being systematically dismantled. The human cost: thousands suffering without care. The biggest victims of this crisis are innocent civilians, many of whom are children. Reports indicate that over 10,000 children have been killed or severely injured since the conflict began. Yet most do not have access to adequate treatment. Families are forced to make impossible choices, like deciding whether to flee and risk getting caught in airstrikes or staying in bombed-out hospitals with little chance of receiving care. A mother of 3, Layla Abu Sharif, recounted her struggle to get treatment for her youngest son who was hit by shrapnel. "We ran to the hospital, but they told us there was no space, no medicine, and no doctors. We waited for hours, but he bled out in my arms," she said, tears streaming down her face. Stories like Layla's are tragically common, showcasing the immense human cost of a war where hospitals are no longer safe havens. The lack of medical resources also means an increase in preventable deaths. Premature babies in incubators shut down due to power cuts, dialysis patients unable to receive treatment, and burn victims left untreated due to a lack of sterile bandages. These are just some of the horrifying realities facing Gaza's sick and injured. The collapse of the healthcare system means that wounded civilians who would typically survive in normal conditions are now dying from treatable injuries. A call for action. What needs to be done? The Gaza hospital crisis is not just a humanitarian issue. It is a violation of international law. Under the Geneva Conventions, medical facilities and healthcare workers must be protected in times of war. Yet, despite widespread condemnation from human rights organizations, the attacks on hospitals continue. To prevent further loss of life, immediate action is needed. Allow emergency medical aid into Gaza. Supplies such as anesthesia, antibiotics, and blood transfusions must reach hospitals urgently. Protect hospitals and medical workers. The international community must hold those responsible for targeting healthcare facilities accountable. Secure ceasefires for medical evacuations. Safe zones must be established to allow the wounded to receive care without further harm. Global organizations, including the United Nations and Red Cross, have repeatedly called for medical neutrality to be respected. However, without pressure from world leaders and immediate humanitarian efforts, Gaza's medical system will continue its freefall into chaos. The Gaza hospital crisis is a stark reminder of the brutality of war and its impact on innocent civilians. As hospitals struggle to function under relentless bombings and shortages, thousands of lives remain at risk. The world cannot look away. Urgent intervention is needed to stop this humanitarian disaster before it spirals further out of control. What are your thoughts on the ongoing Gaza hospital crisis? Should hospitals be protected at all costs during war? Let's discuss in the comments. Stay informed by subscribing to my YouTube channel for in-depth analyses and breaking news updates. Follow me on TikTok for concise updates and share your views below.